Hello, good afternoon. We are at American Heart Association scientific sessions in Chicago, and I am Kamala Tamirisa, one of the electrophysiologists from Dallas, Texas, and I am speaking on behalf of Heart Rhythm TV, and joined with me is Dr. Ekeruo.
Yes.
And she's an incredible colleague, a dear friend, but the interview is because she's my friend. She's a wonderful physician, EP physician, a woman in EP, a powerhouse, and from my state, Texas. And thank you so much for joining me today.
Thank you so much for having me. A powerhouse. I think I need to live up to that.
So if it's okay, I'll call you Ijeoma.
Oh, yes.
And tell us more about your journey, Ijeoma. As a woman in EP, we are so very few of us there in our space. Tell us, just share with our audience, what's your journey about?
Well, it's quite interesting. I actually didn't really think I was going to go into EP when I went into cardiology. I remember my first, review as a cardiology fellow. I had come in and they said, okay, what do you want to do? And I knew I didn't want to do interventional because they wake up in the middle of the night. And I was like, And I said, well, you know what? One thing I know I do not want to do is EP. And that was the time when, all you heard about EP was, they go into the room and they don't come out for 8 hours. And so I didn't think about the disease process. And soon after that review, I actually went into my month of electrophysiology. And I had already planned my vacation. It was for a week. And I was just going to sail through, go on my vacation, and be done with my 1 month of EP. And that first day, I had a patient, and the patient had VT. And interestingly, it was a very stable VT in that the patient came from the emergency room, was in the room, and was in VT the entire time. And I was looking at it, and the patient is talking, and everybody is just, and Dr. Doherty, who was another woman in EP, she turns to me with the EKG, and she says, okay, where is this VT coming from? And I just stopped her. I said, wait, what are you talking about? And she said, well, from the EKG, where is it coming from? And I said, wait, you can use this paper, this EKG, to figure out where it's coming from? Immediately, it was like my mind was, that emoji, mind blown. My mind was blown. I said, okay, tell me everything you know. I want to know it now. And I canceled my vacation. I did my presentation. It changed my life. Like that EKG literally changed my life. And I think it's because, I grew up in Nigeria. I came to the United States for college and then later on for medical school. But I've always been attracted to parts of medicine that use very simple things for very complex diagnoses. And I feel like electrophysiology is one of those where it takes the most simple, and then the therapies can be either medications or it can be the most complex thing. And it just kind of marries all of that together. So you take a piece of paper and say, hey, this is what is happening to you. When a patient will tell you, I feel like I'm going to die, you say, no, that's not what's happening. This is what's happening to you. This is how we can treat it. But it all starts off with the EKG, and that's fascinating.
Wonderful. What an inspiring story, that moment that changed your life. And tell us more about the work for our audience and for women or even men who want to work in this space. How do you take your skills and try to close the gaps out in the community? I know you've done work, whether taking your skills back to Nigeria or within your community in Texas. Could you tell us more about it?
Well, it's quite interesting. So basically, I told you about my interest in EP, and it was so funny. So you have the Texas Medical Center, which is downtown in Houston, where you have all these hospitals and they're taking care of the most complex things. And then not even 5 to 10 minutes away is the Safety Net Hospital in Harris Health, where we had, at the time, one EP that was taking care of the entire hospital system of many millions of patients. And we actually, I was with the UT physicians at the time, and UT actually took care of the patients in LBJ, which is another part of the Harris Health system. They didn't have an EP there at all. So if we had any EP problems, you'd either have to wait for the one physician that took care of the patients or try to figure it out yourselves. And because it's one of those things where, maybe to every, what would you say, to every surface, like if you're a hammer, everything is a nail. So to me, I was seeing EP all over the place because at this point I'm interested in EP. But everybody was like, there's no EP in Harris Health. Like, what are you talking about? Our patients don't get EP problems. So I was like, what do you mean? There's AFib over here. There's, atrial flutter over there. Like SVT, I saw like 3 yesterday and nobody was reporting any of this. And then, it becomes one of those things where, it's a bigger issue because now you have, on the one hand, a hospital system where if you came in with a problem, you would get that immediately fixed. And then you have another hospital system where because people are not seeing it, maybe because they think to themselves, EP is so expensive, you're just not exposing your patient base to that level of care. And so, I actually started out and I said, no, I am going to bring electrophysiology into the 21st century and bring it up to par in the Harris Health System. And actually was the first, I brought an EP clinic to LBJ Hospital, started off the EP clinic there, started off with things as simple as, I worked there for free for a couple of years, right? Started off basically telling folks, hey, if you have atrial fibrillation, bring the patient in. We had so many patients who would come in, they've been treated with amiodarone for years in what they called rate-controlled atrial fibrillation. We would do a cardioversion at the time because they didn't have insurance, so we would do cardioversions. And then the patients would surprisingly get better. Like it was like the simplest things. And so, and for those patients who would get insurance, then we would be able to take them out of the system if they weren't able to get ablations in the system, take them out of the system so that they could get their ablations. And there were so many patients that we helped, patients who were in heart failure that we got out of heart failure, patients who, needed CRTDs that we were able to do so, patients who needed, maybe we weren't able to get rid of their AFib, but we could do an AV node ablation and put in, a conduction system pacing device. So all of those patients, their care was, effective for the better. And that has become, it's always been my passion for sure. It's pretty much about the same thing that I do in Nigeria where, you have a whole country now where they don't have electrophysiology. And we were able to, a group of us who are in this nonprofit called the Cardiovascular Education Foundation, we were able to establish an EP service in association with My Heart, Your Heart, who's actually presenting tomorrow. We were able to help with providing devices for patients. And then we started actually doing electrophysiology there. Did our first EP procedures last year in September. We've done up to 20 now so far, a small number, but it's because people don't even have the concept that this can be done. And so by doing these things little by little, we're just changing people's minds, changing, the concept of what is possible. And so, I'm just very amazed and excited about how much we can do with what we're doing.
Excellent. If someone out there is not inspired with this story, this is incredible. What an eye-opening and just who unfolded a lot of points. There is need for lot more EP physicians. Number of cases of AFib are increasing. And I think it's time as our organization, the Heart Rhythm Society, we've been working in this space as our organization for so many years now. And the exciting thing, just to wrap our conversation, is we have the Heart Rhythm Advocates, which is an affiliated organization. And it's a patient-facing, advocating not only for the clinicians, but also for the patients. And, just join us and, donate and join because we need to advocate, keep our field wide open and going so we can care for our patients. And thank you for your time. And here is the QR code. Thank you for joining.
Thank you. Thank you so much.